today's video, we will delve into discussing eye diseases caused by diabetes in our eye. To begin with, diabetes can harm our eyes in three ways. Firstly, blurriness. Whenever our diabetes is uncontrolled, it can cause blurriness in our eyes. This blurriness is mostly temporary and goes away when diabetes is managed. Secondly, cataract. Cataract develop quickly in diabetic patients, especially in those whose blood sugar is uncontrolled or fluctuate excessively. Thirdly, diabetic retinopathy, which is damage to the eye due to diabetes. We will discuss this in detail today. Normally, the light entering our eyes passes through the cornea and lens and focuses on the retina. These signals are sent to brain and so we see. Retina cannot be changed, transplanted or replaced for anyone. Diabetic retinopathy consists of three stages. The first is non-proliferative diabetic retinopathy. Diabetes damages our blood vessels, causing fat and fluid leakage from the blood vessels. Swelling occurs on the retina and fluid starts to accumulate. This leads to blurriness in your eye. In this stage, we mostly treat with injection, laser or a combination of both. The second stage is proliferative diabetic retinopathy. In this stage, the retina does not receive enough oxygen or blood because the blood vessels are damaged. The eye sends a signal to the brain, resulting in the formation of new blood vessels inside the eyes. These blood vessels are weak, thin and fragile and can burst at any time, causing bleeding and sudden vision loss. In this stage, we treat with multiple injections, multiple laser sittings and medications. The third and the final stage is tractional retinal detachment, which means the detachment of the retina. The new blood vessels formed in the proliferative diabetic retinopathy becomes weak and contract, causing the retina to pull off its place. Unfortunately, the treatment for this stage is only surgery, which is the major surgery, and it's difficult to predict how much vision will return after the surgery. Whenever you visit an eye doctor for a diabetes checkup and diabetic retinopathy is found in your eyes, the doctor prescribes some tests. One of the main tests is OCT, which is like a CT scan of the retina, and angiography, in which photos of the retina are taken to determine the stage of the diabetes and its treatment. Friends, as we know, India is the diabetic capital of the world, so I would like to request that if you have diabetes, get your eyes checked by a specialist once a year. And if you have diabetic retinopathy, get it treated. Now let's discuss about the treatment of diabetic retinopathy. The most important thing in diabetic retinopathy treatment is to control diabetes. Now when it comes to treatment, injections and laser are the most important in treating retinopathy. Injections reduce the swelling of your macular edema, that is the swelling of the retina, and dry up the new blood vessels. These are anti-VEGF injections, which comes in three types. Avastin, which costs Rs 10,000, Razumab, whose cost is 20,000, and finally Eylea, whose cost is 55,000. The next treatment is laser. Laser used in retinopathy is called green laser, which works in repairing the retina. So wherever you have retinopathy, laser is used to heal the retina. Finally, surgery is an option. Surgery mainly has two indications. The first is when there is blood on your retina, which does not absorb on its own. The second is when the retina starts to detach due to traction. Surgery for this is called vitrectomy. After surgery, how much improvement there will be in your vision depends on the condition of your retina. So if you also want to get treatment of retinopathy, call our helpline number now and book a free checkup.